Hey, everybody, this is Munson Steed, and welcome to Health IQ. It is important that we always inform our community with those who are trusted individuals who really know exactly what they're talking about. So, we're not going to trust the internet today. We're going to trust someone who's gone through medical school, passed the boards, and truly is committed to changing and improving the health outcomes of our community, increasing our health IQ, the one, the only, ladies and gentlemen, Dr. Kimberly Turner, MD.
Hello,
Welcome.
Mr. Steed. Thank you so much. How are you?
I'm amazing. What made you want to and dream of and answer the calling to become a doctor and your specialty?
So, yes, it is a calling. I think that I started believing that I could do it even in the third grade at 8 years old. Science teacher told me I was capable, and I believed her. Fast forward, from 8 years old to 22 years old, when you graduate from school and start matriculate into medical school, I really was drawn into the surgical subspecialties, but I couldn't find any surgeons at my institution that looked like me. They weren't women, they weren't people of color. The only place where I sort of felt at home was in OBGYN because they are surgeons. They are women. Most of the physicians in that specialty were women. So I was much more comfortable, and it encompasses medicine and surgery and radiology and women's health. It's just a perfect fit for me.
Given that we really want to talk about maternal mortality, it is a issue. And for all those who are listening, if you could speak to all of us, what would you tell us about how we can save some lives today by just being good listeners?
Well, I think it's critically important for your physician to be a good listener, because I feel like that's really the disconnect in so many of these cases. You hear again and again, the families are advocating, the patients advocating, the mid-level and doula healthcare providers are advocating, but no one is listening. So I don't have a complete answer, but as you know, the mortality and even the morbidity is at least 3 times higher in our race. We're starting to think maybe some of that has to do with our burden of chronic disease. We're carrying more, we've always carried more. And some of these microaggressions and things like that are actually affecting our health. So people should be listening. And in good health systems, even the majority physicians are getting some additional competency training. So I would advocate that you look for that type of provider.
When we think about that, it's easy for us to say, but let's just think about a checklist because I want to say it's not like it happens maybe right after birth. It really often happens post the baby, and we all need to be asking and sharing and being with that mother to help advocate for her. How would you suggest we learn to be even better advocates for our health in general?
Well, I love the storytelling and sharing that we as a community have always done and hopefully are continuing to do. Sometimes even just hearing the stories, knowing in your family the stories of things that have occurred, I think is a really important part of our self-learning and even how then we go on to advocate for our own health.
If you were going to speak Spelman, Fisk, any of those institutions to inspire women to understand that as they move through college and into life, that just knowing their numbers and knowing their health in general, what would you give that commencement speech? Because I know you've given plenty. What would you give? What would be the title of your health commencement speech be?
I think the first thing that comes to mind is our bodies, ourselves. I think that, as women, we go through so many changes, hormonal, physical, mental, emotional. And I think that most people really are kind of in tune to what happens to their bodies. So learning to hear that inner voice, whether it's our physical voice, our spiritual voice, it really can help you to navigate the healthcare system.
And thanks for that. I'm not sure you gave me a title for your speech just
Our
yet, but
bodies, ourselves.
Our
That's
bodies ourselves. So
what's
it that brings me to the other point. When we think about our bodies and we're really trying to understand why we should know our numbers, what
Mm.
are some of the numbers that women ignore that they should just never ignore that complicate all those things from having the baby and not paying attention to your number to just numbers that we really don't want increasing, growing, that we should know as a community are an issue when we talk to our moms, our sisters, our aunts, our grandmas.
Okay. I think the first very important number is your blood pressure. It's really important to have a normal blood pressure when you enter a pregnancy. And most of us, African Americans in particular, are at risk for hypertension just based on genetics and these other things that are coming up, like we talked about, the microaggressions. If you enter a pregnancy with hypertension, you are extremely likely to have a pregnancy-related hypertensive episode. And these are things called preeclampsia, eclampsia, even strokes can happen. The second, I would say, is your body mass index. Again, many of us are entering pregnancy at an unhealthy weight. That's the BMI. So it's really important to do what you can to get that number somewhat closer to normal before you get pregnant. And the third is age. I think that with today's technology, many women are, I know, getting older, getting pregnant at older ages. And again, the body does go through physiologic changes with aging that put women at risk. So if your numbers aren't great, particularly your blood pressure, your body mass index, and you're at an older age, statistically, you're going to be at a higher risk for a complication.
You know, many of the women that you see, as you're beginning to just get them to trust you and knowing that when you take your oath, that they really can tell you anything. How important is that journey between trust and honesty so that you could help heal them versus you find something out in the test that they could have shared with you and allowed you to kind of help them on this journey to decrease the shame, which is going to come out in the test, and increase the relationship with your health provider so that you understand there's not much that you haven't seen now, but we have to be able to trust our health providers.
Sure. I think that's one of the really beautiful things about a long-term clinical career like what I had, because of course, the more you see people and interact with them, if that's repetitive, hopefully, the more you trust them and the stories will come out and they will continue to come back to you. And I think, again, there is something just about people that think that you have the same lived experiences as they do or know that you do that kind of keeps them coming back. One, fun thing that I always did when I was a clinician, to put in the computer, you can put like just a little thing to remind you of the patient because you really honestly can't remember hundreds of people every week. And just even coming back to that, like a little thing that they may say that went on vacation in the past to Hawaii. And if they perceive that you remember, that you care, then they develop that trust very easily.
You know, with health education, movement seems to be one of those things we're not certain about. How important is exercise and movement for women, and obviously understanding when they're pregnant, they still should move and exercise?
Well, exercise is really important and with things like controlling your blood pressure and your weight. So, as we already alluded to or spoke about, those are numbers that you want to be in control. And when you exercise, your blood vessels open up. And if you know anything about a pregnancy, we have one big, huge blood vessel called the placenta. The blood needs to flow through there for the baby to grow, for the mother to have, there's a maternal side and a fetal side, for the mother to have a healthy pregnancy. So exercise helps all of that. It helps to lower your blood sugar, which is another big number that we didn't talk about, your risk for gestational diabetes as an African American. So exercise and movement helps all of that. And there are so many different places to get that exercise in. Even just walking around the block helps a lot. There's prenatal classes at most of our local gyms. libraries, things like that. So there's a plethora of places to go to help you to move if you're not so moved.
I love that when you say not so moved. Some moms might be working to cope.
Mm.
And in coping, what would you say to them to not lean into, even though they seem like they reduce stress, but they're actually not helping?
Well, I think that this touches on, mental health and being in tune to your mental health. Because if they're so overwhelmed with the things of life, and obviously people enter into pregnancy at different phases of their mental health. But if you are not moving, particularly if it's related to stress, then you really need to have a provider that can get you the proper counseling. And, most of us have to move a little bit during work, during raising our children. But the type of movement that we were talking about before, the exercise type, is really beyond your everyday movement.
Yeah. And so I think about mood swings after the baby, mood swings. What should moms know? And what are kind of like red flags to really be aware of and not feel any shame about how you're feeling post this wonderful birth that might not
Sure.
feel that wonderful post?
Well, one thing is that most new moms are sleep deprived because babies get up at all times of the night. So it's normal to feel tired, but it's not normal to feel overwhelmed, to have feelings of distress surrounding how you're bonding with your baby, to have feelings of harming yourself or your baby. Those are big red flags for us. And hopefully, you have at least somebody in your immediate circle that's in tune to your mood as well as yourself. So when you're sleep deprived, a whole lot of different things come to light, and you may not recognize it quite as quickly in yourself. Also, things like lack of enjoyment in any of your normal activities, not eating well, those are also some more subtle red flags.
I'm glad you shared that with us because I think, and then just the removal of shame. You're not
Mhm.
excited, the baby's here, everybody's like jumping up and down, and you're like, not only I haven't had any sleep, the baby really can't tell me what's going on. This is my first child, and I have two or three now, and I'm really trying to deal with this, and I can't process it all right now. How do we let the community know to offer to give either breaks or to at least check in?
I think this is one of the roles that some women are looking for with a doula. That is a certified person that helps you navigate your labor experience as well as your postpartum experience. And circling back to the very beginning of our discussion, I think the storytelling in our communities, I didn't find out that my mother had postpartum depression until I was about 18 years old. And so nobody told me. I'm sitting around with my aunt, and she's like, "You realize that you lived with me for the first 6 months of your life." So how would I know that? So I encourage us as women, as Black women, to not hold these stories back from our progeny. It's really important.
Yeah, I'm glad you said that. But just in sisterhood, what are the things that are often not shared among moms and daughters that really should kind of be during and before even pregnancy?
I think one big thing is the menstrual shaming. Like, people don't realize that it's normal to have a menstrual period and cramping, and then the hygiene that goes along with it. I think that some mothers and daughters still don't talk about that. I would see these teenage women that didn't really understand what was happening to their bodies. The second, I think, is hormonal shifts. The hormonal shifts cause the menstruation, they cause the reproduction, they cause the menopause. And luckily, we have people now, celebrities and advocacy groups that are speaking out about these topics. And I think it's, again, really helpful. I've been giving a lot of menopause talks, and there's a lot of younger women in the room saying, "Hey, I didn't know that. I'm only 30, but I'm so glad that I'm getting this information so that I know what to prepare for in 20 years."
When we say preparing, health seems to be a journey. What should we prepare ourselves better with as it relates to testing, as it relates to being participating in clinical trials? What are those things that we're really not doing that both science and a little bit of courage to get ourselves in the habit of both testing and if you need to participate in a clinical trial to know that it's okay so that everybody else in our community can feel a little bit more comfortable doing those things?
Ooh, that's a long answer. Again, I will go with the things that are really common in our communities, right? Obesity, diabetes, hypertension, heart disease, cancer. There's a lot of screening that can be done. And if you have any kind of access to medical providers, they should be helping you with your screening. And in terms of how we navigate healthcare, again, those trusted partners, the storytelling, I think those are the important things.
Lastly, because I really appreciate all that you continue to give, when you think of the health of our community and the gifts that you've been able to give, what do you imagine or how would you share with those other individuals who are thinking of careers and thinking of why they should maybe not even just be a doctor, but a radiologist, a nurse, and obviously we need more Black doctors, but what would you let them know that they would be doing by serving our community?
Well, if you have health, you have not. If you don't have your health, you really have very little. And if you're born into this world and blessed to be healthy, I think that this inner feeling that of service and wanting to help others is really innate in some of us. And I think that these careers are pretty daunting. They take a long time to achieve. They're very labor intensive. However, if I could have a retrospectoscope, how much reward has been out there just based on almost just me being there as an African American woman. It really was amazing to look back at retirement and hear some of the things that people said, really just even your presence. And I did nothing other than show up. So if that's important to you, I would say consider a career in healthcare. And that can look so many different ways. Technicians, nurses, mid-level providers like midwives, doulas, nurse practitioners, doesn't have to always be a physician.
Cool. Well, Dr. Kimberly Turner, MD, thanks for all you continue to love and allow us to heal and live. And coming on Health IQ, we really appreciate you. Thank you so much.
Sure, thank you.